So when we go to look at bees, the first thing we're going to do is walk through the yard and say, how is this hive compared to this hive compared to that hive? So are there bees coming in and out? Is there pollen coming in and out? How are the bees behaving? Are the flight patterns right? Do I have a pile of dead bees anywhere? Do I have any signs of disease on the hive entrance? Bees have hygienic behavior where they'll take diseased pieces out of their hive and try to fly away and get rid of them. Sometimes they'll drop those on the entrance as they're coming out, so we can see that as they're going. So the external exam is very important, and in a large apiary where there's a commercial beekeeper that wants a prescription for thousands of hives, this may be the extent of what we do for investigation. We may discuss the whole husbandry of the bees, walk around amongst the bees, make sure the number of bees seems appropriate, make sure that the beekeeper has a clear understanding of why he wants to use the antibiotics and that they're proper use. If he's looking to use antibiotics to control chalk brood, which is a fungus, maybe we don't prescribe the antibiotics because antibiotics don't work against fungus. But if he's looking to control American foul brood or European foul brood, he's going to be exposed to those diseases in a pollination situation like almonds, where most of the bees in the country end up in a very small area of Southern California for the month of February. Maybe it's worthwhile to have antibiotic exposure as they're being removed from that, so that if they did pick up any diseases, they're able to, any bacterial diseases, maybe we can kick those before they come home. For that little beekeeper that has a couple of hives and they're worried about them, we'll come in, and once we look at the outside of the hive and we get into the inside of the hive, we usually skip the honey part, which is the top part of the hive. Bees usually work up and store honey at the top, and the queen does all her work raising baby bees or their brood in the bottom. So we'll go through the honey supers, setting them aside. We open up the brood area and we look for things like discolored cappings, because all the babies are capped over with wax coating. So we'll look to see if those are off color, if the bees have chewed through those to see what stinks underneath there. That's a sign of disease. If we have brood that's disintegrated and off color, that would be a sign of disease. So we look for all those signs of disease, and that will lead us either to make a diagnosis or to take samples and send them to the lab. The USDA runs a bee disease diagnosis lab in Beltsville, Maryland, and it's free to send samples there. So it's one diagnostic lab bill you don't necessarily have to get. It's a free service.